help several 100,000 more people with this expansion alone. And also people without insurance. As I mentioned, the cost of everything. My budget that was just enacted prohibits insurance companies from denying access to critical mental health and substance abuse disorder services. Now the insurance companies have to cover. That is going to be a big step toward making sure that everyone has access to quality health care. We're also adding psychiatric beds. You know, what happened during the pandemic? A lot of beds had to be transitioned into COVID beds, but we haven't needed them for a while. And there was a disparity in reimbursements also. Mental health services are very expensive. One bed requires psychiatric nurses. You need to have a doctor with psychiatric background. So the costs are extraordinary. And so we're working with the hospitals to get more beds back online, but understanding there's more cost involved with that. You made all these changes to turn them into COVID beds, flipping them back, there's more security required. I'm seeing Tom Catroci here from ECMC. Thank you, Tom. And Tom has told me firsthand, you know, their desire to bring more beds online, but it's a lot of money. It's a lot of money for hospitals that are still hurting from the revenue loss from the pandemic. I understand that. Tom calls me all the time about it. So more beds online, that's just a start. And also, you know, we're going to continue serving people any way we can. Outpatient services, the reintegration, as I mentioned, freeing up needed space for inpatient care. But also there's one element that you heard me talk about in my budget, and that is housing. The whole continuum of care requires people to ultimately not be living in a hospital bed, not living on the streets, but in a home that is safe, has supportive services, wrap around, and will take care of you with a big hug. And that's what wraparound means to me. And so we're going to be building more of that housing. We're investing in 3,500 more housing units that will provide these intensive mental health services to help someday liberate people from the demons that have taken over their lives so they can walk out someday and say, I'm free. I'm free, I'm going to be okay. I can provide for myself, I can someday take care of a family. And also, as we mentioned, substance abuse disorder, you know, opioid addiction. My gosh. Seems like, you know, I remember not long ago just opening the newspaper and seeing all the obituaries. The faces were so young. They used to be old people, old like me now. I used to read the paper and then I see all these beautiful young people. Opioid deaths increased more than 50% from 2018 to 2021. We were making progress. We had turned the corner somewhat. I've been tracking this since my days on the town board with Tom. And we started seeing the numbers go up. The police would tell us there's kids overdosing from heroin. What do you mean, heroin in Hamburg? Yeah, it was happening 12, 15 years ago. We started turning the corner. And then COVID just hit like this. And all the support system, going with therapists and not having the beds available, it all collapsed again. And that's what we're trying to get out from under. And the use of fentanyl, which is so deadly, and other derivatives from that. You know, so many families, including my own, lost a loved one. And this has to stop. So we can't once again say, well, we can't do anything about it, it's just too much. The scale is too big, it's too widespread. We don't give up. We lean harder into the problem. We say there has to be an alternative for these people that are so lonely, so depressed, so stressed out with life that they turn to this. We have to give them better alternatives. And that is something I'm going to be committed to with every waking moment I am your governor.